A lot of changes happen during the second half of life. Join Kash Mahmood, owner of Varco Hospice and Home Health, and his guest as they explore topics to help you navigate the second half of your life. And now, here's Kash.
Good morning, everyone, and welcome to Second Half of Life with me, Kash Mahmood. Our very special guests today are Wendy Spiller, Jonathan Lowe, and Dr. Chad Niemeyer with Dedicated Seniors Medical Centers. Today, we will be focusing on diabetes, what we need to know. Morning, everyone. How are you doing today?
Good morning. Excellent.
Well, I was thinking we dive right in. Dr. Niemeyer, my first question's for you. How does someone know if they have diabetes?
Thanks, Kash. It's a great question. So I would want all of our listeners to know that to know you have diabetes or to be diagnosed with diabetes, it does take a couple simple blood tests, potentially. That's one way we would know. So things that I would pay attention to, sometimes people with diabetes have symptoms and sometimes they don't. But if you've noticed that you are excessively urinating or making multiple trips to the bathroom more so than usual, that you've lost weight unintentionally, maybe your appetite has increased more than you anticipated, and these are all sudden changes for you, then certainly I would want the doctor to see you to check that out. There are some blood tests that we can do. Of course, the simplest is just to check just a finger stick to check the blood sugar. So sometimes we can diagnose based on a blood sugar test, but we also will do a venipuncture, draw blood from the arm just to make sure that we have more detailed tests. There's a test called a hemoglobin A1C, which gives us an average measure for over the last 3 months what your blood sugar has been. And based on those tests, we can make a diagnosis. So definitely look for symptoms, but you may not have symptoms, and would recommend that you see your doctor so that simple blood tests can be done to identify for that.
So what do I need to watch out for if I am diagnosed with diabetes?
If you are diagnosed with diabetes, it's very important that we look out for some of the complications of diabetes. The thing about diabetes that makes it harmful is the effects it can exert on the organs of the body. So we certainly want to make sure that people take very good care of their feet, because we know that diabetes over time can affect the nerves and the blood flow to the feet, which can lead to ulcers and other things that can cause limb loss or worse. We want to make sure that the eyes are examined every year, because certainly we can see changes in the retina, which is the back of the eye, that can affect your vision. And so over time, that can happen as well. We want to make sure that the kidneys and the heart are closely monitored, because certain changes that take place with diabetes can put a strain on those organs as well, and lead to dysfunction. So those are the main things. Of course, we want to keep an eye on the blood pressure, which is something also that can be done during the context of a visit with your primary care physician, because diabetes is an increased risk factor for heart disease and stroke. We also want to make sure that we keep that blood pressure very, very well controlled. And so these are all things that we do on a regular basis in our office as a primary care practice.
And the good thing is that we have a podiatrist here on staff as well. So our patients can just run right in and see them if they ever need to.
Exactly. And Kash, the other thing that we do is Wendy and I will actually go out into the public, and we'll do public engagements where we'll talk about diabetes, and we'll bring Dr. Niemeyer in, for example, and he can talk about the different topics. Our medical staff is always available to go on to senior centers and other community sites to be able to talk about those critical topics.
We call that celebrity events, when we have our doctors go out to the other centers.
For sure. And really educating the community about this topic is extremely important.
It is.
Wendy and Jonathan, really, this question, I'd like to get your feedback on this one. Aside from the medications, are there any diet or lifestyle tips that can help control diabetes?
Oh, well, exercise, of course. Dr. Niemeyer actually has here at our Northline Center has what they call bingo size. So they have it's a bingo game, and exercise all combined in one. And they come in and they can actually win gifts too. So that's even better. It's even better. So keeping that body active, it actually helps.
Absolutely. And the other thing is, and Wendy hit it, I mean, it covers that, having exercise programs in our centers. We have really an events room where we in the public, we can bring fitness instructors in, where we'll do different types of exercise classes. But we also do and can do nutritional classes as well, where we can talk to our members or prospective members about exactly what to eat and what not to eat. I hate to tell you, there's a lot of miseducation, or basically misunderstanding and lack of education on nutrition. If you go into the grocery store, all I'm going to say is probably about 90% of what you see is probably bad for you. So most of us are not eating right, and that extends to medical professionals. That extends to all of us. You have to really be careful with nutrition, and that's why we really try to help our patients, understand of what they can and can't eat, and being realistic at the same time, helping them to tear down maybe on some of those bad foods. I know Chad is looking at me because a lot of times you can't get them to stop everything, but maybe if we could just tear it down a bit, right? And so I defer to him.
Yeah, I agree. I think that small changes, and I think that's the big thing that's important that I highlight with patients is it can be overwhelming sometimes to think about all the different changes that what are the best things to do, lifestyle measures that we can do to help prevent diabetes or manage diabetes. I know for many it can be overwhelming, but in the context of our visits, when I'm speaking with my patients, we try to hone in on small, couple things, and that way not to overwhelm anybody, but just, hey, let's focus on just the exercise aspect of it. What's one simple thing you can do every single day that you enjoy, and it doesn't have to be an hour-long session. It can be a small amount of exercise, something that really gets the blood flow, the blood pumping, the heart pumping, and helps the body move, and build on that. And so I think it's really important that we break it down into smaller increments, and over time, you'd be surprised how much progress can be made.
There you go.
Absolutely.
In what ways can dedicated senior medical centers support someone in their efforts to keep diabetes under control? I mean, I know you mentioned exercise and certainly diet is one of them, but aside from those two, or even within those two, what would someone do?
Sure, I'll take that. We have a full team, and ultimately, as Wendy and Jonathan have both mentioned, whether it's our podiatrist who helps us to manage those who may have diabetic-related complications of the feet. We have classes for diabetes education that our patients can participate in, and basically promote more self-efficacy when it comes to managing their own conditions. And also learning more about it and what questions to ask and how best to advocate for themselves. And then we, as the primary medical team, we follow our patients very closely. We check labs. We have labs on site that we can do for our patients, so that we can intervene if any kind of adjustment in the medication regimen or any new measures need to be taken to make sure that that's well controlled. We have telemedicine as well, and I think diabetes is a condition that in many ways does set itself up well. It lends itself well to telemedicine, because I can call a patient, we can do a telemed encounter, and I can go over their numbers, and we can maybe make adjustments together from the comfort of their home if they're not able to get out of the home at that time. And so there's a lot of things that we can do to partner with them to make sure that their numbers, that their diabetes is staying under good control, and that we're addressing those challenges that come up.
That one of our values here is accountability, and like Dr. Niemeyer alluded to, that our whole team actually works with the patients. So we have what we call love calls, that we will actually call them just to check on them. Dr. Niemeyer and his team will call and check on his patients to make sure that everything's okay, if they need anything. So that way they're kind of getting a jump on if anything's going on, they can prevent it, try to prevent it or help the patients.
Absolutely.
Excellent. Jonathan and Wendy, I know you guys touched on, going out into the community, but are there any specific events, or can you give us some examples of, educational seminars that you all do within the community just to educate them about, what options they have?
Oh, absolutely.
Oh,
Here in a
wow.
second, I'll defer. Yeah, I was about to say that's
That's the fun
a
part.
good question, Cash. In a second, I'll defer to Wendy, but I wanted to let you know one of the things that we do is we will go to senior communities where we have the opportunity, as I mentioned previously, about taking our doctors there. So we can talk about diabetes, we can talk about nutrition, we can talk about other medical conditions. We participate in health fairs. We also work with local brokers and agents. So one of the things that I do is I go on out there and talk with brokers and agents that handle Medicare, for example, and Medicare Advantage. And I talk to them about the benefits of our medical centers and the different services that we provide to patients, and talking about exactly how we can help them, how that they're going to have that relationship one-on-one with their doctor, how they're going to have an opportunity, whether they need same day or next day appointments. We're going to talk about that. We're going to talk about how they can have x-rays in-house, or how they can end up having their blood collection, blood draws in-house, as opposed to having to go off-site. But we go on out here, like I said, it could be health fairs, it could be senior communities. We set up tabletops and different events, and that's where I'm going to defer to Wendy, because she has done some of the most incredible tabletop events out there.
Oh, you're so sweet. But we do, well, on top of those, the tabletops, which I'll talk about, but we do have those celebrity events where we do have the Dr. Niemeyer and some of the other doctors go out into into some of the senior citizen homes and talk about whatever topics they want to talk about. And then we have those tabletops that Jonathan mentioned that we call them, I'm not sure if you've ever heard of Medicare 101 sessions, but we do a lot of those in some of the communities as well as here in the centers. And what those allow us to do is just to have the seniors come in. Medicare is so complex sometimes, and some people need to break it down to them a little bit more. So what we do is we kind of break it down to them a little bit more so they understand what plans they have, what they actually have in their plans, what are some of their benefits. So we definitely go out to the community, but we also have them come into the centers and do them as well.
Well, and there's another thing to Wendy's point that we do. Cash, what happens sometimes, because we accept different, we have 5 carriers that we accept. And so a lot of our patients coming in have questions about their benefits. So what we do is we set up where we have the carriers come in and they can talk specifically about their plans and about those benefits. So say, for example, we have Anthem and AmeriGroup come in, or we have Humana come in and talk about it. Or, we can have Aetna come in and talk about the different events or about the different plans. That way members better understand what benefits those plans have. And we do it in a nice facility where we take them through, we talk to them about their medical needs, but at the same time, we're also having the carriers come in and address the questions that they may have about their plans.
Mm-hmm.
Excellent. So, the education part you guys do extremely well, and I mean that's very, very impressive. But it sounds like, when somebody's diagnosed with diabetes, there is definitely a change in lifestyle that needs to happen. How does Dedicated Seniors help, their patients with this new lifestyle changing and then, maintaining it?
I'll speak to that first. I think one of the things, having worked in other settings before coming to Dedicated, I will say that as a PCP, one of the great resources I have as a PCP with Dedicated is time. We have a smaller patient panel, so maxing out at 450, whereas before might have been managing 2,500 to 3,000. And so you wonder why your doctor often seems there in a hurry. Well, here, we have more time with our patients. We see them more often. And so, as I was saying before, ultimately, I think that those opportunities, those small interventions that we can embark on together in the context of that visit to be able to say, we want to talk about exercise today. So here's what we're going to talk about, and counsel the patient, make sure that there's understanding, answer any questions. And that way, they're potentially in a position to be able to go out and be more successful with that as they leave. And then we can focus on diet, nutrition the next time. And I think that in a lot of settings in the primary care realm, the model is, get in, prescribe a medicine, get out, go to the next room. And I think that oftentimes that leaves little time to really talk about some of the lifestyle changes that are so critical to the management of conditions like diabetes. And I think that what Dedicated has done is essentially say that time between a patient and their doctor is very important, and we want to try to maximize that time so that questions can be asked, patients have understanding, and real change can take place. So that's, I think, one of the biggest resources we have.
I have to say that the people at Dedicated, the staff at Dedicated, can actually really help them change their life. If you enjoy going into the office and going into the doctor's office and seeing the doctors as well as the staff, then we can help encourage them to make those changes. Number one, by going to some of these events that we have, whether the exercise events, even the educational events can help them with their lifestyle changes. But I think the staff makes a huge difference in helping our seniors with their lifestyle changes. Because you gotta love us,
Well,
and like being around us. So.
Well, exactly. And Kath, to your point earlier, how many times in our own lives have you gone to a doctor's office and the doctor has sat down with you and said, okay, in my case, Jonathan, you need to lose weight. And then pretty much opens up the door. And I'm looking at, okay, well, how do I lose weight? What do I eat? What programs can I go? And I think that's where the frustration of a lot of patients are, because they get this advice, but there's no follow-up. Our model here at Dedicated allows our doctors, they have fewer patients, they have reduced panels, they can spend the time with the patient. We have other internal specialists to help. So we're not just going to sit back and say, okay, well, you have diabetes. No, we're going to talk to you about nutrition. We're going to talk to you about medication management. We're going to talk to you about wound care. We're going to bring you in as often as you need to have that care. And I have to tell you, my mother actually died from diabetes. And it was the hardest struggle because, she didn't have time with her doctor. There wasn't really any information. I just fortunately had, I had worked in the medical field, so I was ahead of the curve a little bit. But I got to tell you, it's an overwhelming task when it's a loved one, or maybe it's you personally. So I have to tell you, I love this model. I love the caring, compassionate doctors and clinicians and staff that we have, because they will make the difference and they will help that patient through their journey to better health.
Yeah.
Yeah, no, that's great, really. I mean, and it sounds like you guys are doing the full circle approach, right? I mean, you're going out into the community, you're educating them, and then when they're coming in, it's that one-to-one personalized approach. And then all of these events that you do inside your facility, it creates that group initiative, because changing lifestyle, if you are going to be in a group, it becomes much easier, because then everybody starts to support everybody. So that's great. Yeah.
Exactly. And Kash, one last thing. Not only do we do like educational events and events about their benefits and other different medical topics, but today at the center I'm at, we're actually doing a movie day for our seniors. If they really they come in for their appointments, or they just don't really have anywhere to go, we do special in-center events. It doesn't have to always be medically related. They can also be fun and social interaction. So I have to tell you, I'm absolutely enjoying movie. It's actually the next room over from me. It's a movie day, movie Mondays. So I wanted to share that with you. We do a lot of fun things in addition to a lot of the necessary things as well.
I'm coming over for the popcorn.
Absolutely.
That's excellent. No, you guys are doing a great job. Well, I've really enjoyed having you guys on the show. As always, this has been extremely informative for our viewers. Thank you so much for being on the show and really serving the community.
Thank you, Kash.
Thanks, Kash.
We appreciate it.
Thank you, Kash. Appreciate it.
Bye-bye.